Welcome to the Byja radio show. I'm your host, Dr. Byron Jasper, and we are recording live from J. Kinba Executive Suites in Baton Rouge, Louisiana, with special production by Becnel Media. All right, we are back once again in the mix. Happy to be back, man. I mean, after the last episode, I didn't know if we were going to make it after all the running and jumping and all the other stuff that had to happen. But we're back. Happy to have, I believe we're on episode 14. Episode 14, man. So I'm Dr. Jasper, and I am happy to welcome you to episode 14 of Byja Radio. And of course, I have with me my stupendous, amazing co-host, the one and only Patient Zero. Patient Zero, how you doing, my friend?
Man, you too kind, my good brother, but I'm doing well. I can't complain about too much, man. If I was any better, I'd be you. So,
no complaints there. I would agree that is an accurate statement. Not one lie told, as some of the young folks would say. So today we have an interesting episode. We are trying to just go right into some topics because there is no real question that has been posed, but things have come up in my patient practice that are pretty surprising. So needless to say, the most surprising part is when I have to have this conversation with the patient and they are asking, well, what about this? What about that? And not knowing how to have the talk or the vernacular relevant to this topic. And today's topic, as simply as I can state it, is about testicular health.
Yep.
Testicular health. Now, most people know what the testicular region is about. Some people have no idea because some people don't know the anatomical terms that we use in medicine. But the idea overall is for us to talk about this in a way where it becomes comfortable. We want it to be comfortable for patients, but also potentially family members of patients to be able to have a discussion, hopefully with the healthcare professional, and not feel embarrassed, upset, frustrated, or just to the point where they don't know how to even bring the conversation up. So we're going to talk about just basic stuff anatomy-wise around that area. Also talk about some common things that may pop up in the area that, you need to be aware of. So sure. I think it's a simple conversation. Sometimes it's a little embarrassing, but I think we're going to kind of go into it. So we'll start with the first part, which I think is just identifying what's in the area. Okay. So I'll start by asking you a question. Has anyone ever kind of went over the anatomical terms with you about that area? Not necessarily you're in an exam room, but more so, look, we're talking about anatomy and what it is that's in there and what is or isn't actually working, how it works. Anybody ever go over those things with you?
Now, I can't say that I've ever had that experience. I remember in middle school, we took like a human sexuality course.
Right.
And we kind of dove into a brief overview of like some of the different parts of the body, what they do, but it's been about 25, 30 years, something like that. So I don't really remember.
Okay. So if you haven't had this conversation in a long time, most people haven't, right? Not really. Do you ever hear male patients talking to other male patients, friends or whatever about testicular health? And that's the unfortunate part, because believe it or not, the female counterparts usually have conversations about things like breast health and vaginal health and making sure that they're getting checked on a regular basis. Hence why a lot of times women tend to live longer, because they're actually getting health conversations in a lot of different formats. It's not just when they go to the doctor, and then let alone men don't tend to go to the doctor, which is a whole nother conversation. So we'll start with some basic anatomy. All right, so we'll start with the first thing that most people know the actual parts of. All right, so we're going to try to use regular terms and try to keep this as serious as possible, because I know you're silly. And I see you already smiling, so that already tells me we're going to end up laughing a lot. However,
I'm going to try not to laugh.
We're going to try not to. Okay, so we're going to try to make this...
It's an adult show.
Absolutely. It's a educational adult show. Yeah. So let's make sure we try to keep that part focused. Okay.
We should be on PBS.
So not even close. That would be very awkward. So let's go back to very basic terms. So we'll start with... I'll ask the question and you tell me if you know what's the name of the actual anatomical part that we're talking about. Okay? It's going to seem weird on the first one, maybe the second one, but after a while, I think you may get it. Okay? All right. So this is the area of the actual region that's meant to be basically the protection of the region as a whole. Okay, so it's the thing that basically holds everything in place.
I would say skin.
Okay, great. You're on the right track. Starts with an S. But what is the actual part called?
Starts with an S.
Starts with an S.
Scrotum.
Scrotum, right. So the scrotum is the actual piece that is meant to be protection of the testicular region, but it also does other stuff. One of the big things a lot of people don't know about the testicular region is that the scrotum is not just something that is there and it's skin. It also helps with protecting from things like rashes and stuff like that, of course, injury, and then more importantly, it actually helps with temperature management. Believe it or not, the goal of the scrotum is actually to help keep things in that area from getting too cold or too hot, because if it does, then you start to have malfunctions in the area. So believe it or not, it's a big part of not only protection, but temperature regulation. So that is the first thing. And that is probably one of the biggest things that most people know. So we're moving on. Next thing is probably the largest piece within the scrotum. And obviously, it's the topic we're talking about today. What is the original name from an anatomical sense of the two biggest parts within the scrotum?
Oh, that's easy. Testicles.
Testicles, right. So testicles are basically the biggest parts, and that's the part that most people know about, right? And with those two, the idea of that is we're trying to make sure that people know that there's more than just that. It's not just the scrotum. It's not just the testicles. There's more to it, okay? So we'll move on and we'll talk about what the testicles potentially do, but the idea is that those are the two terms most people know. All right, so there's about 3 more terms we're gonna talk about, maybe 4, but 3 more terms. So one is a actual, basically tube that connects the testicle into where you're actually moving things from the testicle into the actual penis itself. Okay, starts with an E.
Give me the second letter.
E-P. P as in Paul.
No clue.
Okay, all right. That's why most people don't know. And this one is actually really important. So let me back up a little bit, and this is going to be why it probably makes a little more sense. So the testicle, as the most part, has the function of doing 2 major things. The major thing is to help produce testosterone, and then also to help produce sperm.
Correct.
So with those 2 things, this tube has to find a way to get things from the testicle to other parts of the body. It's basically what we're trying to get into, if that makes sense. You can't just produce something in that area and it just magically goes where it needs to go. It has to have transport, right? So one of the transport tubes is the epididymis. Epididymis. And that's a term most people never hear, right? It's a term that if you hear it, more than likely you're either talking to a physician or something's wrong. Right?
Right.
It's not a term a lot of people know, but the key part of the epididymis is that it basically stores and transports sperm.
Yep.
If the sperm is mature, the epididymis is probably involved. So testosterone and sperm are made in the scrotum, in the testicle, and then the epididymis helps to make sure that the storage of the sperm and the transport of the sperm is actually moved to the next place that we're talking about. So this is another part that comes and in essence meets the epididymis and eventually turns into this. Starts with the letter V as in victory.
I'm going to go with vas deferens.
Vas deferens, right. So the vas deferens, yeah.
Yep.
So that's it, right? So
I got that right because I'm smart.
There you go. So
and I looked at the outline.
That you did. I think that's a huge thing when you're preparing for a podcast or a radio show. Your idea is to, read the notes that the doctor gives you and tells you, hey, you may want to read this. This actually is helpful. So the idea of the vas deferens is meant to transport sperm when a person is obviously sexually active and is basically about to finish and ejaculate, right? So that is another structure which is basically within the scrotum, right? So right now we've named 4, and there's one more, but we're going to make it simple. We're not going to go too technical on that one. And what is the last thing you think that helps to keep everything working?
Blood vessels.
Blood vessels, right? So nothing in the body that is an organ can function unless you have blood flow to it.
Correct.
That is something simple. So your brain, if you don't have blood flow to it, is a problem. Your kidneys, your lungs, your liver, and of course even your reproductive organs. So if you don't have good blood flow down into that area, those things start to get diseased is the best way to say it, right? So those are the 4 to 5 things that we're going to talk about. Okay. So based off of that quick summary, all right, let me see if you can rattle all of them off and what they do.
Okay.
All right. So floor is yours, my friend.
All right. So, the testicles or the
Testes, right? So it's plural.
Yeah. They produce sperm and testosterone.
Right.
The epididymis
There you go.
stores and matures sperm.
Yeah.
The vas deferens transfers sperm for ejaculation. Blood vessels regulate temperature for sperm production, and the scrotum maintains the ideal temperature for testicles.
Yeah.
So
The only other thing I would say about the scrotum, and it's the biggest part that I would say, it does protection, right?
Yeah.
It definitely is more of a like skin of anything else. It protects.
holds it together.
It holds it together and also protection, right? Okay. So
I was in Chicago and I was cold as hell.
Yep.
Don't think the scrotum was working because I was that cold.
I'm pretty sure that there are plenty of times there is always going to be a story when it's cold and how it doesn't do what it's supposed to do. But believe it or not, it's probably doing way more than you think. But the other part is, besides temperature regulation, as you just mentioned, it's helping to keep everything doing what it's supposed to.
Sure.
It has to work together, right?
Gotcha.
Because again, when you're sexually active, the idea is all these parts have to work in order for it to hopefully do what you're supposed to do, which is to enjoy sex, but also to potentially procreate, right? So if you're trying to conceive and these things don't work, then there's a problem.
Yep.
So that takes us to the main part of why we're talking about this. The main part of why we're talking about this is talking about diseases, right? A part of the podcast is not only educating people on direct primary care and how we do this, but it also is talking about different diagnoses that we run into. So why is this coming up on this episode today? Well, I actually had a patient with one of the diseases we're going to talk about. And one of the things we talked about, gentleman came in, hadn't been to the doctor in several years, if not almost a decade. And he came, signed up and said, look, I want to have a full physical. So one of the parts of the physical is we have to basically check in the actual genital area if a person may or may not have complaints. I asked him, I said, look, do you want us to do the actual genital exam? You feel like you're okay, you're not having any problems? And he said, yeah, I'm doing okay. However, I'd rather be checked than not. I said, that's completely fine. We'll go ahead and get it done. Long story short, we did a check and we found something when we actually did a check in the testicular area, which is different than a hernia, which is different than feeling on the pelvic area, looking for different things that could be problematic. We were talking about specifically the testicular area, which has its own problems, which is different than other parts. So based off of that came into the things we're going to go into. So any thoughts about that? Any questions about that? Does that make sense? Being that you're potentially the person who's on that patient side that says, yeah, you know what, I've thought about that. I've had that conversation before.
Well, I mean, you know, that just brings a whole bunch of questions because I'm curious. I want to know, like, what did you find? What are the threats? You know, what is this patient's options? Because as a patient, that's what I'd be thinking. You know, I'd want to know, okay, what exactly is going on? What caused it? What can it potentially cause? And how do we fix it?
Yeah.
Or like, how do I manage this if it's something that you can't fix? I don't know. You know what I mean?
Yeah.
That would be my thought process, though.
Yep. So I think some of those questions are very simple, very straightforward, but they're great questions, right? Your goal is to say, okay, what diagnosis and how often do you find these things? How common are they? And we'll talk about that in a moment as well. So I think overall, that is a huge part that we're going to end up leaning into. Now, before we get to that, we do have to do some housekeeping. I should have did this earlier, and I want to make sure that we get a point to do this. Yep. So some of the simple things that we have not done and we were told we need to do a better job at, it's just basically asking people to subscribe, to like, to share, to actually follow, or whatever else those terms are. Because again, if we're doing pretty good work, we're hopefully educating people and we're explaining really good topics. Our hope is to obviously grow this. And if we're growing this the organic way, that takes other people to do their part, which is to comment, to subscribe, to share, and all that good stuff. So one of the things, of course, is we're on multiple platforms, right? We're on, I believe, Apple Music, Apple Podcasts, Spotify, SoundCloud, and I think we're iHeartRadio. So, I mean, we're on a bunch of different platforms, especially this. So if you like it, you love it, you want more of it, let us know by, subscribing, sharing, and giving us positive feedback. Yeah. And I think that's simple.
It's very simple. And, and it's crazy that we're talking about, the testicles on this episode. But, and speaking of testicles, it must have taken like a big pair to just sit down and write a book.
That's one way to think about it.
Like you just sit down and write a book. So not to put the doctor on the spot. Well, but you just wrote a book, and I read the book. It was a good read. I'd like for you to mention it, comment on it.
Yeah. Well, thank you for the segue.
Yeah, you're welcome.
Very awkward segue, but hey, segue nonetheless. Hey, I see what you did there.
Hey, you like that? There you go. Took a pair to write the book. I haven't written the book.
I think that is something that's forthcoming for you. I could see that happening. But the book is the Byja Blueprint. I definitely need to plug that. Definitely on plenty of platforms. It's an ebook. We have, I believe, Apple ebooks, Barnes & Noble ebook, and then other platforms. But there are also Amazon and Barnes & Noble to get a hard copy. And at some point, we're going to release an actual audio version. So got to work on that. A lot easier said than done when you're talking about audio stuff. But hey, we're here on the audio side, so we're doing that. So back to the episode. I think that's important to kind of jump into, well, why did we literally say, okay, we're going to do an episode today? As we talked about, we had a patient. George brought up some good subjects. And, well, what did you find? All right. So one of the things we found is something relevant to one of the structures. One of the structures, and I'm going to throw it back to you real quickly. Starts with the letters EP. What is that one?
Epididymis.
The epididymis, right? So one of the things that you always learn in healthcare is that basically the finish of a word having itis on it.
It's not good.
It's not good. But the framing of itis usually means inflammation. So what do you think the term would be if a person has inflammation in the epididymis?
I would say epididymitis.
Epididymitis. That's right. There you go.
Yeah.
So one of the things that we potentially found was pain in the actual testicular region, but not the testicle itself. So when you're doing a testicular exam, basically you're trying to see if there's any discomfort or any masses or anything in the area that shouldn't be there. And if you have a person who has pain in the region, but not on the testicle itself, you start to basically identify other anatomy and have to figure out if this is indeed a problem of this structure or that structure. And as you already know, there's multiple structures down there, right? One of the main structures, as we know, is the epididymis, which basically sits on the top of the testicle and then comes off the testicle so you can transport sperm, right? That can get inflamed and have inflammation, hence epididymitis, right? So based off of that, how common do you think epididymitis is? If I had to put it into a term of 1 in 100, how many people would you say, hey, this is probably affecting this many people or that many people?
Out of 100?
Out of 100.
And it's not in my notes. So I would say...
I did that on purpose. I wanted, because you like to hedge and, just get to the point where everybody thinks you know all the answers. So, we had to set you up a little bit.
I just enjoy being right. There's nothing wrong with that.
Yep.
But if I had to guess, I would guess maybe 30%. So 3 in 10, maybe. 3 in 10. Because, inflammation can come from a bunch of different things. Mm-hmm. If it's just something that's just general as inflammation or infection in the epididymis.
Epididymis.
Yeah, that one.
Yeah.
I was on a roll. I had to mess up.
The epididymis is very close to the epididymis, right? It's the epitome of the epididymis.
Yeah, it's right there.
There you go. Okay.
They're all together.
There you go.
But, I would assume that it's more common than what you would think.
Okay.
So I'm going to go with 3 out of 10.
Yeah. So you're on the lower end. It's actually somewhere around 50 to 60%.
Yeah.
Yeah.
That's a lot.
It's a lot of people, right? And the problem is a lot of people don't know what it is. They may think it's, a pulled muscle or, I got a pain in my groin area, so I'm just assuming. But it actually is a pretty common thing. Now, the idea is that it's roughly 600,000 cases of epididymitis gets diagnosed in the U.S. in a year. 600,000, right? So the 600,000 cases can be problematic, right? Now, all that being said, that is not the worst. right? It is still pretty high. But I think overall what we're talking about is what is the common range for people?
So, I'm sorry, not to cut you off. You just brought up like several more questions.
Okay. Well, let's go through those questions.
So, how, outside of just looking at it, let's say somebody is just doesn't even feel it. How do you know? Is there another type of test that can tip that off, or you just got to say, hey man, check everything out? Like, how do you figure this out?
Yeah, so great question. I think one of the big things people don't realize with certain things in the testicular region, it can be caused by a lot of different things, right? So one of the common things that causes epididymitis is infection, right? Commonly, it is usually in sexually active males, so usually between age 19 to roughly 35 is when you see a lot of the diagnoses popping up. And then as you get older, you can potentially still see it. But STDs or STIs are common causes of epididymitis. It's not impossible to have it when you do not have an STD or an STI, but it's likely that that's the cause. So that's the first thing we always want to look for, hence why we always have to potentially check for it, right?
Sure.
Outside of that, other things that can happen is just bad anatomy. As people get older, when I say bad anatomy, as you get older, believe it or not, then that's why and I have to say it as simply as I can, when you see men get older and they start wearing underwear that are a little bit more of the, as you would call, briefs, right? Not the boxers, where it's a lot more tight, it's actually to help support the scrotum. Because if the scrotum is basically having problems and not supported, it can cause epididymitis and other problems. So that is another reason why some people can just have this pop up. It's not just because they're always out doing something that they quote unquote shouldn't. It's just sometimes as you get older, things start to not work the way they should.
So, let's bring this down to a pretty easy level, right? Yes. That where most men think.
Okay.
Right. So, in your opinion, as a doctor, it's healthier to not wear loose boxers than it is to wear like boxer briefs or something like that, because the scrotum has more support.
If that question comes in, I think it kind of depends on the person, right? It depends on what the person's doing every day. It depends on if the person is actually going to be straining and doing things. And I'll give you a prime example. If you're a person who's going to be lifting a lot of heavy stuff, you're needing to probably have more support in all structures, right? Your lower back, your groin area, and then sometimes even your knees and, places that are going to have a lot of strain on them, right? So it wouldn't be a problem to say, I'm going to have more support in that area by wearing this type of underwear or this type of support, a jock strap or something like that, to allow me not to have a problem down the road. Now, if you're a person who's going to be sitting on the sofa and not doing a whole lot, you may not need as much support compared to somebody who's doing a lot of lifting. Now, the other side is if you're younger, you usually don't need as much stuff compared to when you get older. When you get older, obviously things don't work the way they used to. That's just called life. So as you're older, you may have to switch to more boxer briefs compared to just boxers. So these are just simple things that people don't know. And I've had patients who've literally come in and they'll say, well, I'm having this problem in the area, and we've done all the STD testing, we've done all the evaluations, and we've literally come up with just, look, anatomy is not what it needs to be. You have to change the type of underwear you're wearing because you're going to end up having problems whether we want to or not. It's just the way that life is going. So if we change and it goes away, we'll do that. And there's other treatments for it as well, but that's one of the common things. So hopefully that answers your question.
No, that's a big help, because I can't speak for everybody else, but I haven't heard that.
Yeah.
And I think that's important to touch on, because that's something that's very, very simple that, we can do as men to increase our health. Yep. Just you go to Target, you go to Walmart, instead of reaching for the boxes, you get the boxer briefs or whatever. That's something we need to know.
Yeah. So that is a common cause, like I said, bad anatomy. And the last thing is, besides an STD, is just infection in general. So a bladder infection can cause an epididymitis, or a prostate infection. And those don't oftentimes have to do with being sexually active. They just happen. So those are common things that can cause it. So that's one. That's an epididymitis, right? Inflammation of the epididymis. So there's one more that can happen in that same exact organ or piece of an organ that can be a problem. I should say structure, not an organ. So based off of that, what other things do you think can happen in the epididymis that may be problematic?
I would say if you pull something, can't you move the wrong way and mess something up, or
Yeah.
it could be like a muscular thing.
It's a possibility. So not necessarily hurting the structures in the actual testicular area, right? The structures in the scrotum don't tend to get pulled, if you will. Muscles tend to get pulled, right? So things around that area tend to get pulled. But one of the things that potentially stands out that can happen in that actual area is something called a epididymal cyst. So basically, it's a cyst within the epididymis. So inflammation of the epididymis is epididymitis. That can happen from the things we just talked about. And then some people can just get a cyst in the actual epididymis, which happens a lot. It is basically a fluid buildup in that structure that starts to cause dysfunction and pain. And believe it or not, that's what our patient actually had. Our patient who came in, who was having pain when we did the exam, but we didn't know what, we said, look, it could be epididymitis, but it could be something else. So we had to literally do more to figure this out. But it turns out that he actually has a cyst in the epididymis on one of the actual testicles. So what is the common cause of a cyst in the epididymis? Well, basically, it's just something that sometimes happens. As you said, it can be a traumatic experience. A person gets hit in the area. A person has a fall and basically contacts the area incorrectly. They're playing a sport and they get hit in that area. That trauma can cause it. But other things is it just happens. No specific trauma, no specific injury, and it just builds up. And that buildup is just there and it causes problems. Now, I'm going to ask you a question. How old do you think most men are when they start to see this type of diagnosis?
That's a trick question.
Because
I feel like just looking at this, I feel like most men, based on what you've described, most men may experience this, but having an actual diagnosis requires you to go to the doctor and get it checked out.
Okay.
So I would assume that they're a little older. So I'm going to say between 35 and 50.
Okay. So I think you're spot on. It's actually around age 40, right?
Okay.
So around age 40 is when people start to see this more often. Now, it's not saying you can't be a younger person and get it. It's also not saying you can't be an older person, but around age 40. And funny thing is, how do you think the gentleman was that basically came in? What age range do you think he was in?
You know what? I'm going with 40.
He was in his 40s, right? He was literally in his early 40s. That early 40s just warranted exactly what we just talked about.
Sure.
Look, these are the common things we see, so it makes perfect sense that this is what he is potentially having. So that is something that is huge. And a epididymal cyst is actually pretty benign, right? It's something that tends to not cause problems. It's something you find. If it's there and it is causing problems, you can get it treated. If it's not causing anything, you just kind of keep an eye on it. Epididymitis, on the other hand, depending on the cause, if it's an infection, more than likely you have to treat the infection or it's going to progress. Versus the epididymal cyst, it's not an infection, it just happens. So it really is you need to get the right diagnosis. You can't just assume, hey, this is something that is A versus B. You treat it kind of haphazardly and it gets worse. So that's a huge thing. So we got two more things that I'm going to talk to you about that are more, we want to know about them, we want to kind of understand them, and then we want to potentially be mindful of them because there's a huge part that will go into not getting these treated. Okay. So these two are very specific. These are things that people won't tend to notice unless they're doing certain things. Now, one of the things I'm going to pause and recommend is to basically have men, if you're listening, or women, if you're listening, talk to the men, ask them, do they actually check their testicular area? This is akin to what we would call women doing a self-breast exam. So women do self-breast exams or they are recommended to do self-breast exams when they get to a certain age to help look for breast cancer, right? I think overall this is very simple, where you have men, you're talking to them and saying, we want you to do something similar to prevent testicular cancer. So that is a testicular exam that should be done. So in order to get these other diagnoses, including epididymitis, and also the epididymal cyst, is to potentially have a person checking their testicular area at least once a month. Once a month. It's simple. That's literally, if you're in the shower and you're washing, you basically do an exam where you're feeling the actual anatomy in the area and seeing if anything feels abnormal. If you say, well, how do I know it's abnormal? Well, you have one on each side, most people. If you have one on each side, you can compare one to the other. And if one feels off compared to the other, then that's probably an issue. And that's when you need to come in and get checked. If both feel the exact same, then you usually feel pretty good that there's nothing going on. So a testicular exam is something most men should be doing as they continue to get older, because you don't want to say, well, they figured out they had testicular cancer and it's advanced so far because they never checked. They never checked until it started having pain or swelling or discomfort or discoloration. You need to check and catch it early. Much like with women, you need to do a breast exam, catch it early so we can treat it and obviously have long-term success at eradicating cancer, rather than we didn't find out till it was too late. Okay, so based off of all of that, these last two that we'll talk about that are on that, if we kind of find it side, you'll be like, okay, kind of makes sense. So one is called a varicocele. Okay, I'm gonna ask you a simple question. Where do you think the varicocele is found relevant to the anatomy we talked about earlier? So you got 5 structures that we talked about.
It's in the scrotum.
Good. I hope so. That would be important considering we're in that area. So there's 5 structures. You said scrotum, testicles, epididymis, the vas deferens, and then blood vessels. So it's one of those 5.
I'm going to go with blood vessels.
Blood vessels, right? So why blood vessels? It sounds very similar to something you have in your legs. A varicocele sounds like what?
In my legs?
In your leg. Not your legs, but legs in general. Say it slowly.
Varicoceles.
Varicose veins, which are usually in the legs.
Bro, I wouldn't have known that.
You would have known that, obviously. That's why you're here with me. So the point is,
that's why I'm patient zero and not the doctor.
So varicose veins, most people have heard of them, right?
Not me.
Okay. So varicose veins are basically where the blood vessels in the legs are not pumping blood that flows down to the feet back to the heart. Veins take blood back to the heart. Arteries take blood away from the heart, right? So if you have varicose veins, what it is the veins in the legs are not strong enough to pump blood back to the heart. So they start to bulge and are very, very easy and painful to see sometimes in people who are often on their feet for long periods of time. So surgeons, postal workers, teachers, people who stand up for long periods of time tend to have a lot more issues with varicose veins. A varicocele is very similar to a varicose vein. It just happens to be in the testicular area. That's all it is. And most people are surprised when they're like, oh yeah, that actually is very simple. It really is. It is that the blood flow that goes down into the testicles is not coming out. And if it's not coming out, what do you think happens?
You get clots.
Well, not clots so per se. It gets swollen.
Yeah.
It gets very big and painful. So a varicose vein doesn't tend to have clots. It's not saying it can't. It's not a common thing. But it basically just causes really prominent bulging of the veins into the actual superficial skin on the legs. So a varicocele is very similar. Basically, you're having a bulging sensation in the testicular region that can be problematic. So based off of that, you will literally see that happen often. And that's something that's very common. Now, my question to you is, where do you think age range this shows up oftentimes?
Later in life.
Right.
That's probably in your 60s.
Right. That's what most people think. It's actually on the other side. It's actually pretty younger, right? It's actually the teens to early 20s are the most common where we see that. It's not impossible for you to get older and have it, but a lot of times people have trouble with their anatomy. And this goes, and I'm not going to go into this one because that topic would be forever. It's basically when children are born, if the testicles don't do what they're supposed to and descend into the scrotum, it can cause problems with the blood vessels, right? So all of that being said, some men or young children who will potentially turn into young men will have problems with their blood flow and their blood vessels that they can develop a varicocele when they're younger. So that's something that happens. And then, of course, when men have varicoceles and they're not really treated and diagnosed appropriately, they have trouble with infertility. So that's another huge part that can be problematic, hence why you want to make sure this is diagnosed and diagnosed well. So that's 3. And I think we have at least 2 more. Yep. So I'm going to do one more, and then I'm going to talk about the more problematic one. So we got one more. So we got a varicocele. The actual other term for one we didn't talk about, the epididymal cyst, is called the spermatocele. Because the actual piece of the epididymis is to do what? Help with storing mature sperm. So when there's a cyst in the thing that stores and makes mature sperm, it's called a spermatocele. So that's one, varicocele, spermatocele, which has to do with sperm. Varicocele has to do with blood flow. So there's one more. I'm going to give you a hint. It ends with seal.
I'm going to go with hydrocele.
Okay? Hydrocele, which is spot on. Amazing. Now, what is the hydrocele, if you don't mind me asking, since you got that with no problem?
Yeah, I'm a wealth of knowledge at this point. It's fluid buildup around the testicle.
Correct.
That could, be painful or cause swelling.
Right. And again, I want to make sure that we kind of conceptualize this. So the epididymis is a structure that sits on top of the testicle that can have a cyst. Spermatocele is what that's called. The varicocele is the blood vessels flowing into the testicle having a problem that is causing swelling. Varicocele. So hydrocele is water or fluid that's in the actual scrotum that surrounds the testicle. It is not in the epididymis. It's not in the blood vessels. It literally is just its own fluid by itself, and it shouldn't be there. Hence why sometimes the testicles feel really big on one side compared to the other, because one of the things is really filled with fluid. It's a hydrocele. So hydrocele is something that also happens, and basically a lot of times it is found in younger children, right? Male children who are basically not really sure what's going on. They all of a sudden start having fluid, and then it's a problem, and then we get checked, and it's something called a hydrocele. Now, it also can happen when you have problems with injuries like anything else. And then, of course, if you're having a hernia or a problem where all of a sudden you're lifting up on something pretty heavy, it can cause problems there. So the hydrocele is something that can happen. Varicocele can happen, or spermatocele can happen, and an epididymitis can happen. So those are four pretty common things that happen in the testicular region that are, for the most part, really simple in terms of, hey, we have this problem, we diagnose it, we can get it treated. They are often easy to get treated in terms of, hey, if we catch it early, we can get these things fixed, and it's not going to cause long-term problems. Now, it's not fun to get them treated, but it's something that you want to actually get treated sooner rather than later.
Yeah, makes sense.
So thoughts on that? Any questions about that so far?
Nah, man, you've definitely heightened my awareness.
Right. Well, I got one
on the lower region, because I don't even think about it.
Right. I got one more for you. Now, before we get to this one is extremely important. Before we get to this one, we got to, again, plug some of these wonderful things we're doing and small commercials. So one of the things I want to plug is that we are obviously trying to get the word out, not only about the radio show, also about the book, but also about our nonprofit. So we have a nonprofit called the Byja Charitable Alliance, and this is a effort where we are trying to make sure patients who are often wanting to do direct primary care are able to get access, even if they're not able to afford all the bells and whistles. So if you are a person who has that giving spirit, or you're in a place where you want to help improve the lives of people who otherwise would go without really good high quality healthcare, you can make a donation that's tax deductible to the nonprofit, and it will literally go towards things like our patient assistance program, where patients get access to direct primary care doctors, also get access to generic medications, and even low cost labs. So look us up online. It's www.byjaca.org for Byja Charitable Alliance. And if you do a quick Google search on the Byja Charitable Alliance, it should pop up and you'll see our website. So wanted to definitely plug that. George, anything you wanted to actually mention or anything? Because I know you're a hardworking man. You always got stuff going on, from extracurricular activities, giving back to the community and stuff like that. So, I mean, I don't want everybody to think it's just Byja. Patient Zero actually works outside of being Patient Zero. So anything you want to shout out right now?
I'm working on a new brand called Becnel Consulting. Essentially, what we do with that is just, if you have a small business, medium-sized business, whatever, and you're not sure what technology you need in terms of computers, monitors, printers, internet service, phones in terms of cell phones and or phone systems. That's something that we can help with at Becnel Consulting. We'll come to you. We can charge by the consultation, or we can be put on retainer. So any more information you need on that, you can reach me at info at Becnel Consulting, or 225-955-2737 is the number for that. So that's something that's near and dear. That's something I've been working on, and I think that's it. You shouted out me for my MBA last time we talked, so I appreciate that.
Yeah.
And other than that, man, I hope Alpha Phi Alpha and the 100 Black Men don't take me out in the meantime.
Well, I already know you're working hard on other things within those two organizations, but definitely wanted to make sure we show love to you doing your own thing, which is huge, because being a entrepreneur and a small business owner is not for the weak of heart, and it definitely is not for people who aren't about doing extra work. So seeing you step into that arena, I'm proud of you, man, and I hope that we are slowly but surely going to see great things from you. So let's go back to the episode, and then we'll slowly but surely close out. So what is the biggest thing that I would say? I hope most men know that this is a serious problem and you don't want to mess around with this. So again, we talked about the epididymitis. We talked about the epididymal cyst. We also talked about a varicocele and a hydrocele. So the last one, which I won't even ask the question because I want to make sure people understand the severity of this. The last one that men need to know, that if this happens, this is not I'm a wait and see if it gets better. This is I need to go and get checked. It is called testicular torsion. Okay, testicular torsion. Now, all things considered, if you use context clues, most people understand what torsion is. And obviously testicular means it's in that area. But the idea is that basically there's a twisting of the vessels and the structures within the actual scrotum that is causing the blood supply and things in there to just start dying. Okay? So now I want to make sure you all heard that patient 0 has uttered the word that most people are surprised whenever we say that it is causing problems to where death is happening in that region. And it's not something that easily just snaps back, right? If it's starting to cause problems where blood flow is going away, as I mentioned, decreased blood flow to an organ causes organ death. So at this point, you're having a problem with blood flow and basically anatomy not working the way it should, that you start having problems, that it is a emergency. And I don't mean it feels bad. I mean, this is probably one of the worst feelings that any male patient can have. And you have to go directly to the emergency room to have it addressed and treated, because if you do not, it's going to be a long-term problem that cannot necessarily get reversed. And my question for you is, how often do you think this happens in terms of the number of people that this affects? How many people would you say out of however many?
Out of 100, I'd say 5.
Okay. So it is, according to the stats that I pulled, it says 1 in 4,000 men, this gets diagnosed 1 in 4,000 annually.
Oh,
1 in 4,000.
That's a lot better than what I thought.
Yeah. So now this is the thing. Who do you think this affects mostly? Now we talked about how many, but how age range do you think this happens?
Twisting of the testicle. Teenagers,
absolutely. So it's actually from 12 to 18.
Yeah.
So if you are listening to this and you have a young relative, son, cousin, or whatever, this is probably where the uncomfortable conversation happens, but it is something you need to know. Those that are playing sports, those that are potentially dealing with things that could be traumatic, right? And I'll give you a case in point. If you have relatives and they literally work in a farm or on a farm, right? You can possibly have trauma in that area, riding a horse or something like that, riding motorcycles, dirt bikes, all these things. That trauma can happen, and all of a sudden you're sitting here thinking, oh, it's just uncomfortable. I think I'm gonna just sit around and wait to see if it gets better. But that trauma and that twisting can happen to all of a sudden we're in a problem that it's not going to be easily reversed. So from 12 to 18, it happens. And when it happens, it all of a sudden is something that needs to be emergently dealt with. So based off of that, that is the biggest one. That's very rare, but it's very serious. The others are probably less rare, but are not as serious. Most of them are possibly things you'll find, and if you can have them, we get them treated, then great. But if you don't have problems with them, not a big deal. Testicular torsion, on the other hand, is a huge problem, right? We do not want to play around with that. We don't want to have any issues with that. And if I have a patient who calls and said they had a fall or a traumatic incident in that area and it's really uncomfortable, I'm not going to tell them, well, just wait and come see me in the office. I'm going to say, you may want to go get checked out, because I'd rather make sure that this is a normal, just uncomfortable bruise or whatever, compared to, well, it's misdiagnosed and we call something that can't be reversed. So that's huge, man. And that's something that I'm glad that we got a chance to actually talk about, because what happens with a lot of people is that they don't really and truthfully have these discussions until they come into the office. And at that point, it's almost somewhat too late, right? We've had these issues so long that we don't even know that, hey, there's a way to get treated. And there are definitely treatments for each one. The common ones, of course, are taking medicine. Then sometimes it's a surgical intervention, but the goal is to get treated appropriately rather than just do stuff and ignore it. Okay. So based off of that, I'm going to turn it over to George and ask what are his thoughts. And of course, I'm going to kick it off with a simple question. How often do you think you can have a deep discussion like this in a traditional primary care practice?
Well, I mean, being that you only see the doctor for 7 minutes, I'd say not often at all. You know, I had an appointment yesterday and we talked for an hour. So none of this didn't come up. So I'm kind of shell shocked at all this information. But, you know, I don't think you can have this type of, you know, conversation in the traditional model. Basically, you know, in my experience with the traditional model, you only got a couple minutes to say, hey, this is what's bothering me. And then there's a diagnosis. Like there's no more questions, you know, and if you really think about it, it's kind of ridiculous because somebody like me, I haven't, you know, I don't think I'm the slowest person in the world. I know some stuff, but I haven't been trained medically, so I don't know. All I know is what I experienced, right? I don't have the foresight to say, hey, this is everything that's important that I need to tell you, and I can leave this out. Like I just tell you what I feel. And for there not to be more of a conversation with questions, open-ended questions that try to get you to arrive at a certain point, I don't know how you make a diagnosis.
Right.
You know, so yeah, I to answer your question, I kind of went on a tangent a little bit.
No, I think you're spot on.
I just feel like, no, you don't have these type of conversations often in the traditional model because there's just not enough time.
Yeah. And I think the other part that I like to highlight is not just there's not enough time. It's also things that you highlighted sitting here as I'm talking to you. So I'm talking in a way where I know what I know, right?
Right.
I know what the varicocele is. I know what a hydrocele is. I know what a spermatocele is. So all these terms that get thrown out. But as I'm saying stuff, I see your face like, well, what about this, right? What about this? What about that? Those questions that come up elongate the visit, right?
Right.
If everything is, well, he understood everything I said, asked no questions, I could possibly knock this out in a 7 or 8 minute visit. But if you are a normal person, you're going to have questions.
Bro, you can't tell me my testicles are swollen and there's a reason for that. And it's going to be like a 7 minute conversation. I'm like, no, wait now. Like, no, we need to get this fixed.
Right. We need to have this discussion, right?
And I need to know exactly how this happened.
Yes.
Why it happened.
Yeah.
How can I make sure it not happen again? And I need a clear plan to move forward. Because look, this ain't cold, brother.
Yeah. Yeah.
It's not rub some vapor rub on your chest, take some NyQuil. This is something serious.
Right. And that's the problem that a lot of people don't think when it comes to other diagnoses. Now, obviously, being in the area that we're dealing with, being the sensitive conversation, the sensitive nature of the topic, yeah, people might take this a little more quote unquote seriously. But the conversation as a whole that we're highlighting is that when you have questions, you don't want to rush. You don't want to sit down, say someone tells you some devastating news, but we got to roll because I got some other things I need to do. So you need to get your questions together and then we can have a conversation versus, hey, I'm giving you stuff and questions come up, but we only can answer a handful of them. So all things considered, I think you have to have that detail that this is going the way it needs to go. So with that being said, let me know if there's a conversation that a person ever has when they are getting diagnosed. And with that conversation, are they going to sit back and say, man, you just diagnosed me with something I never heard of before. I have absolutely, positively no questions. That's unheard of. I don't think it has ever happened in my exam room where I tell somebody you have a new diagnosis and that person ends up saying, yep, I have no diagnosis. I have a new diagnosis. I have absolutely no questions. Rarely will that happen. If it does happen, I think it's probably because the person already knew they had something and they've already been well versed in that conversation. So that's something that's simple, straightforward. And I think a lot of people are happy with us in the direct primary care model that we have enough time to really dive deep into a conversation like this, along with other conversations where the heart attack, diabetes, stroke, kidney problems, skin problems, things like that. And I bring that up to say for this patient that we're talking about that kind of kind of made me say, look, I think we can talk about this. It's going to be an uncomfortable conversation for some people, and some people may not even listen this far. But if you're listening this far, kudos to you, because you're actually taking it seriously like we do every day within my practice. But the part that I want to get at is that the patient who had the problem with the cyst, not only did we, number one, examine him and potentially tell him what this could be, we then went the next step of saying, look, we need to get an ultrasound of this area, because if we don't do the due diligence of going further to make sure this is not something problematic, it could be something that we're misdiagnosing or mistreating, and all of a sudden it's going to get worse. So with that, he got an ultrasound. After the ultrasound, I called him to go over the ultrasound results. And then after going over that, I actually sent him additional follow-ups on the hydrocele, on the varicocele, on the spermatocele or the epididymal cyst, to say these are the things that we're talking about, so you can not only hear me explain it to you, but you can go and read about them and look at the pictures and know more about what they are and what they're going to do. And then we made a plan to say, when are we going to come back and look at this again? Because it's not just something you do a one and done, and the one and done is over. You have to literally say, I'm going to diagnose, I'm going to appropriately manage, and we're going to follow up. And if we follow up correctly, then that'll be something that we really and truthfully want to do. So I think overall, that time that you have with the doctor, who then not only has time with you, but he's going to have time after to go through these things, are actually helpful. So I think that's overall something that's huge. So with that being said, I think we're going to slowly but surely close out. So all things considered, I'll start with the closeout and then I'll throw it to you, George. So hopefully this episode has been helpful for some people. I could see it being uncomfortable for a lot. I can also see it being a sensitive topic, but I actually applaud patient zero, because he only laughed, I think, 2 times and only cussed 1 time. And I don't think most people even heard the potential laughter or cuss word when it happened. Now,
it's going to get edited. It won't be on here.
They won't know that you did it. But I will say that I was expecting it to be a lot more of, I don't even know what to say or not say, but that goes to show that this man is an extreme paramount professional, that even with topics that could easily go into pure debauchery, he literally kept it together. So that's the first shout out I'm going to give to him.
Appreciate that.
The second thing I'm going to actually highlight is that, again, you may not need to or want to remember half of what we talked about. But if anything comes out of this episode, I hope any male patient or female patient who has the male relatives explains that they should be checking that area at least once a month. And if you say, well, when should they do it? I would say when they start in their 20s at the absolute earliest, if you feel like that. Now, if you feel comfortable having the teenagers do that, then more power to you. I understand that could be uncomfortable, but if you're in your 20s and you start the good habits of checking regularly, if something pops up, you'll know it early. Versus, hey, we're waiting till we're in our 50s and then it's been 30, 40, 50 years of untreated, undiagnosed problems that we just talked about, which these are a handful. There are others, but we wanted to go over those handfuls. So those are the 2 things that I wanted to shout out. Again, patient zero being a paramount professional, and then also making sure people remember to check at least monthly for any abnormalities that we talked about or things beyond that in that area. George, I'm going to kick it to you. You tell me anything that you would say are your take-home points for today, and then again, we'll go ahead and close out.
So I think this one was an eye-opening one for me, because there's so many things about this region I had no clue about, right? And so it's just something else to look out for when you're taking care of yourself. I think it's all about taking your health seriously, empowering yourself to make your own health decisions, and getting a resource like yourself to help you out with that. Because at the end of the day, yes, you're my doctor, but you're not responsible for my care. I am. You're just probably the best and biggest resource I can have. Right? So, and just being around you and having a lot of these conversations about my own health, we've talked about things like blood pressure in grave detail. We talked about A1C in grave detail, cholesterol in grave detail, things like that, to where I felt like I was kind of catching on to certain things. So this episode was a reminder of how much that I don't know, because I'm not medically trained. So it's eye opening to, and it's a reminder to, hey, pay attention, because there's a lot that you don't know, and if there's something that is abnormal, more than likely it's probably not a big deal, But that small chance that it is a big deal, you would want to know, and I encourage you to get it checked out. So I guess I went on a long way to say, pay attention to yourself. Look at yourself in the mirror. See how you're feeling. Keep a journal if you need to, but just really pay attention to your body. And if something is not right, say something.
Yeah. Be honest with yourself. I think it's another way to say it, right? You don't want to sit down and have in your mind that something feels off, but it's not a big deal.
Correct.
Right? If you don't know, how about you find out? And that idea that, it's just a lump, it's just a bump, it's just a rash, it's just a mole. Again, crazy. It may be, but the goal is to make sure we don't sit there and say, yeah, that's all it is. And then all of a sudden it's something that could have been treated or removed or addressed early on in the process. And so far that it would literally prevent you from having problems down the road. So all things considered, I think George hit on some really good points. Take care of yourself. Be honest. Don't sit there and downplay things and hope that they magically go away when you have people sitting here wanting to treat you, help you, take care of you, and keep you out of trouble. So I think that's it, man. I think we had a pretty good episode.
Yeah, I think
considering
so.
We have literally talked about something that I don't know too many podcasters will go to, and I'm going to tell you why. We hear about prostate health, right? We hear about breast health. We hear about lung cancer and all this. I don't know if too many episodes that I'm aware of ever talked about testicular health. Well, and more importantly, did it without laughter.
Yeah, it's not a fun topic.
I mean, it could be.
Because the whole time you're talking, I'm like in my own head, like moving around, like, wait a minute, is everything okay? Like, I never thought about this before. So it's not a fun topic to talk about. It's kind of made me scared a little bit. But
if I get to scare you into getting healthier, then hey, I'm okay. I think my job is 80% done.
I think we've done well.
But imagine also if you have somebody who's listening, and this episode gets shared, and they're like, "Man, I actually had that problem, and no one even told me that I need to get it checked. I just been feeling something uncomfortable, and I finally went and got it checked and realized this is a problem I've been having." More importantly, let's say you're having a couple and they're having trouble conceiving, and they don't know why. And they don't realize that it could be an anatomical problem because the male has something going on in this area that otherwise we would have never known. And this episode helps to hopefully put them in that, hey, we need to get this checked.
Or I've had a bunch of friends that's had children in the last few years. Or if you're trying to conceive, it might help you just to knock this out first.
Yeah.
And just, just get checked first. Make sure that everything's in working order down there, because that's one less obstacle you got to deal with later that could delay your family, could delay your plans and all this good stuff. So, if you have those type of intentions, you might want to be thinking about this before you get started.
Yeah. So that's why I said if this episode allows people to get better, get healthier, I think we're doing a good job here at Byja Radio. So we'll close out. Officially, I'll mention one more thing. We do have a newsletter. It is on our website. If you decide that you go to our clinic website at www.byja.org, we have a section on the homepage that is for a newsletter. We try to send out a newsletter and some emails to everybody on our list at least once a month. So check us out, because they have helpful topics like this in written form where we talk about stuff like this on a regular basis. Some people actually get the newsletter and don't realize it because they put us in the spam folder. I don't understand why, but hey, we're going to change that. So based off of that, this episode, we're talking about the newsletter, but also we take the newsletter to talk about the radio show. So it's a kind of a crossover. So if you are on the newsletter, we love it. If you haven't gotten the newsletter, please do that, because you can share that as well. And then the same thing, again, like, subscribe, share, comment on the Byja Radio Show. We love to see it, and it also helps us to keep going because we know we're making a difference in a lot of people's lives. So based off of that, we're going to officially close out the episode. We got patient zero with us. Our hope is to, again, get a little bit more consistent, but life is always lifing on both our ends because we're constantly trying to build new stuff. So sometimes this ends up being a little more difficult to get going, but I think we're going to get to where we're hopefully putting out content regularly. And from there, we appreciate you for listening in. We will plan to see you at the next episode. And again, thank you for tuning in for Byja Radio.